Hi team, in this video I'm going to be talking about two stages that I see my clients go through on the healing journey. The first one being when you've been doing a lot of the work for a while and you are ready to take a break from it. And the second one is coming back to therapy and doing the work again after you've taken that break. And I've had this experience with my clients this week. One person has been working with me for over a year and they've said that they're ready to take a break. And another person came back to work with me this weekend and we had a conversation around why they came back and where they are in their healing journey. So I wanted to just share a little bit about my experience of people being in, and my own experience as well as my clients. Oh, excuse me. As well as my clients. So the first phase is often in the beginning, especially when you first start going to therapy and if you are doing the trauma healing work, there's quite a lot to unpack. And whilst we as trauma practitioners and therapists prioritize your safety, prioritize your stabilization through helping you develop and understand what you need for grounding, for orienting, resourcing. And we do practices with you which the emphasis is placed on pendulation and titration. And if you don't know what any of these terms mean, that's fine. Please go and check out my Trauma Informed Foundations playlist where I have a video on all of these different terms and what they mean. We prioritize a lot of things so that your experience of recovering from your experiences that you've been through is as gentle as possible. However, of course, people are releasing a lot of stored emotion and stress from the mind, from their body, from their heart, from their soul. Often things that have been there for decades, because even though we might come into therapy with one particular thing that we want to focus on, the body as a way of recognizing that you are doing the work and can begin to release a lot of old stored stress as well. And so it can be incredibly energetically draining. And even though we are helping you to build capacity and to release a lot of this stored stress and tension from the body and from your mind, and that does come most of the time with a lot of relief, a sense of lightness, that a weight has been lifted, that the tension has been eased. Doing this week in, week out, week in, week out, week in, week out can still feel draining and like you don't have the capacity again to do it any longer. Like it's got a certain lifespan, that level of deep work, because it takes a lot of energy to do it. It takes a lot of patience for you to do it, a lot of self-awareness. And so it's not sustainable to do it for long periods of time. Now, of course, like I said, if you're working with a trained professional, then they will hopefully do the best that they can to ensure that you are doing this work as gently as possible, right? But it still does take its toll. So it's understandable when clients say, I think I'm ready to take a break. And there's a couple of reasons why they want to take a break. So the first reason being that they're tired, that they need a rest from it, need to recuperate and rest and then come back. That often looks like just taking a couple of months off to rest and to integrate and to process all the things that they've been doing the work around, because whilst they're doing the work, they've still got lives to live, they've still got jobs, they've still got families, they've still got world events to navigate, etc. So taking time to rest and integrate and reflect and process on that period of more intense work is a really good sign, because it shows us that you are listening to your interoceptive cues from the body, from the nervous system, and that you are honoring this cue from your body that you need rest, that you need a break, which is a huge part of healing from trauma. As the trauma and a burnt-out nervous system, they are two different things, but causes a disconnect between our inability to connect with our body's interoceptive cues. So if you can identify, I need a break from this, this is a good sign. This is showing that the healing is taking place. So it doesn't necessarily mean that all the work is done, and it's not, you needing a break isn't a sign of failure or anything like that. The next reason that people take a break is because they feel that they've done everything that they need to do. Now, this is often around when clients come for one specific thing that they want to work through, and maybe after 10 or 15 sessions they feel like they've talked, they've reflected, they've looked at it from all different angles, they've worked on it from all different angles, and that there's nothing left anymore, that they feel fine and that they feel restored and they feel safe around this particular concern. And so they think the work is done, and it very well might be. But like I said a few moments ago, often when we do this type of work, even if we are trying to focus on one specific area, the body has been storing stress for a very long time, and it can start to want to release and process other things that sometimes we know about and sometimes we don't know about. There's just stress in the body that needs to be released. So even though we think that the work is done, and it very well might be, that doesn't mean that you won't want to come back and continue doing some other work in the future. And the third reason that people often take a break is because a little bit of both. They need a rest, and they are kind of done with the work, and they have a really strong desire to be present for a while, not that all the work in trauma is about revisiting the past, but some of it is. Some of it can be. It's completely dependent on your situation, but a lot of it on occasions can be about processing past events and identifying behavioural patterns, etc. And and coming to therapy and doing all of these practices. And it's that mixture of feeling like I'm done and I need a break from it, because they really want to be in the present moment, and they want to go out there and they want to get on and live life and put themselves back in situations where they are going to be able to approach things differently and enjoy themselves and have focus on the priority of like being joyful and experiencing pleasure and being present with people and finding the peace within themselves again. So they're the three main reasons that I've experienced that clients are ready to take a break from doing this work. Now, the second phase is when clients come back, and sometimes clients can have these kind of doubts or a little bit of shame, ultimately, that why do I need to go back to therapy? I thought I'd done this work. I thought I was okay now. And they often forget that how far that they've come. And also that the healing journey isn't this upward trajectory where we are just taking these steps and we are, I've done that thing now, so I should be over it. I've done that thing now, so it should be in the past. No, like we are often swinging back round in our lives to different events that trigger that activation within us. But this time when we swing back round, we've got more capacity, we've got more self-awareness, we've got more compassion for ourselves, we're more resourced, we've got the tools and different perspectives. And so we revisit those things naturally, and it's okay if we still want support for those things in our past. Absolutely, it's totally normal. I definitely use my therapy sessions for revisiting things from the past, and I talk openly about the fact that I still feel activated by my past today, despite, you know, doing all the work that I've done. It doesn't matter. Doing the work doesn't make you forget. Doing the work doesn't make you forget what happened, and it doesn't mean that it wasn't upsetting either. It just means that you are approaching it feeling slightly different each time, and that is a sign of healing, as is your ability to identify, I'm coming back, I want to go back to do therapy. This is an incredibly big indicator, wonderful indicator that you are healing, because you are now listening to your interoceptive cues that I need support, I want to co-regulate with somebody, I want to have support with this work, I'm prioritizing my own self-care instead of collapsing into shame and you know, self-judgment around going back and doing the work again. And that's fantastic. That is a sign of healing. And just circling back, I just mentioned, obviously we come back round to past events, but also the reason that we return into the therapeutical space and relationship is because new things happen. New things happen that create levels of activation that can feel similar to what we were doing before, or can be completely new. And we want to get support around that. And that, again, that having that level of self-awareness and being able to prioritize your own self-care is a really fantastic indicator that your healing is taking place, that you are healing. So I wanted to share those two different phases with you today, and I'd love to hear from you in the comments about if you've experienced either of those, both of those. Also, I'd love to hear from you if you've got any questions, any concerns about anything I've said, or any questions, concerns, thoughts, opinions that you'd quite like to share. Please go ahead and do that in the comments section below this video. And if you found this video helpful, sorry, I'm struggling to wrap this up. If you found this video helpful, please consider it liking it, subscribing to the channel, sharing it with somebody else. And if you're on a healing journey and you want support with that, just to remind you again, my name is Donna Louise, and I help people to get out of survival mode, to restore their nervous system, and then to reconnect with themselves again. And healing, just to finish, healing has its seasons, and your need to take a break and do other things is part of the work. Allowing yourself to have the space, the grace, the rest, to live life, to move on for a while is part of the healing work. It's not separate from it. Not all healing work takes place within the therapeutical space, nor does it only take place out of it. It is this beautiful confluence of the two, the self-regulation and the co-regulation. Thank you very much for watching this video. Until the next time, take very good care.